Have you ever heard of Plenity? Plenity was FDA approved to help with overweight and obesity and was approved for BMIs as low as 25, which is lower than we typically see for other treatments for obesity and overweight. Who am I? My name is Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician, and I practice through a telehealth clinic called Missouri Metabolic Health, serving adults all throughout the state of Missouri. And I want to talk to you today about Plenity because I'm kind of embarrassed to say this, but I did not know that it was discontinued. Probably because I've never prescribed it before. I just knew it as an option that was available for patients. The truth is, we have so many other great options to manage excess weight. Plenity is actually not a medication, but it did require a prescription from a physician or other healthcare provider for it to be obtained. It was technically a medical device, and it was really a capsule that you took like a medication, but you would take it prior to meals, and then it would expand in your stomach, take up space, and help promote fullness with smaller portions. So it would help with portion control. And it was considered to be a safe option. The most common side effects were GI related, as you would expect: a feeling of fullness, acid reflux, nausea, changes in bowel movements, those sorts of things. But it was very rare to have serious side effects with this treatment, which is partly why it was approved at lower BMIs at 25. I recently thought about this medication because I saw a patient who her BMI was 26 and she was struggling to reach her weight goals, but she did not qualify for our current treatments because right now they're FDA approved with a BMI of 27 or greater with a weight-related condition such as high blood pressure, high cholesterol, diabetes, sleep apnea, those sorts of things, or a BMI of 30 or greater. So she did not meet criteria for medications for weight management. So I thought, hey, I remember that Plenity was an option and approved for a BMI of 25 or greater, which she met that criteria. So I was looking into prescribing it, and then to my surprise, it was discontinued. So why was it discontinued if it was relatively safe and could help so many people who had a BMI of 25 or greater? The reality was it was discontinued because there was not very much demand for this product. And the reasons being so were that it really produced fairly modest effect. People were not getting the weight loss that they typically would expect with a medical treatment for excess weight. And especially when you compare it to our newer agents, the GLP-1 agonists, Wegovy and Zepbound, this did not compare by any means. These newer medications far outshined Plenity. And even our older options, Phentermine, Qsymia, Contrave, tend to have much more weight loss than Plenity does. So people were just not wanting to utilize it. So it was no longer cost effective for them to manufacture it. The reason I bring this up is because the way that Plenity works is very similar to how fiber works in our body. It helps fill our stomach so we feel full on less food. Many people would, instead of prescribing Plenity, recommend taking psyllium husk like Metamucil or other brands to take that before meals so patients will feel that fullness and eat less during a meal to help with the portion control. Not to mention, fiber has many health benefits like decreasing risk of cardiovascular disease, maintaining a more neutral blood sugar, decreasing the risk of diabetes, also decreasing risk of certain cancers like colon cancer. Because there are more benefits of fiber compared to Plenity, that makes sense to me. It's also less expensive fiber supplements are. So that's a great option that anybody can start even without the guidance of a physician. You can get your fiber supplement at any store or online and take that before meals. I do recommend slowly incorporating it, so starting just once a day and maybe starting with 1 scoop rather than 2 scoops if 2 scoops are recommended with that brand. You want to slowly increase, or else adding too much fiber at one time will cause stomach upset. But this is a great way to help curb appetite before meals. It also makes me think of the difference between supplements and prescription medications. The weight loss that was seen with Plenity was more consistent with what we see often with supplements compared to medications that are FDA approved for weight management. The truth is, medications that are approved, especially nowadays, have extremely rigorous requirements that they have to meet. They have to be proven to be safe, first and foremost. Second, they have to be effective. They're not going to approve something that, compared to placebo, has no benefit. It has to be proven superior to placebo. And oftentimes it has to now be proven superior to what is already on the market. So we're wanting to not only add more, medication options, but we want each one to be better and safer than the prior. And that's what we've been seeing time and time again. Oftentimes, decreasing weight alone is not enough to get a medication approved. They have to show improved long-term health outcomes. Supplements, on the other hand, don't have to prove anything. They don't even have to prove that they have what they say they have in their ingredient list. Some companies do utilize an independent company to analyze their product and make sure that it does have what they say they have in it at the quantities that they say that they have. And there is a label, the USP label here is an example of one independent company that you can trust. So I always recommend to choose supplements that have this label. Supplements do not have to report side effects. So they're able to make claims and focus on the potential benefits and ignore any potential side effects. And the truth is that each and every year, there are thousands and thousands of ER visits and hospitalizations that are attributed to side effects from supplements. You always want to be honest with your doctor and tell them the supplements that you're taking, because many of them do interact with other medications, especially blood thinners and blood pressure medications. Also, mental health medications, they may interact with those as well. So always share with your doctor everything that you're taking. Even if you think that it doesn't matter, it would be helpful for your doctor to know. I will also link a website where they have really helpful, reliable information about supplements that are on the market. You can check what you're taking to ensure that it is safe for you. Like I said, I was a little embarrassed to not know as an obesity medicine physician that Plenity was discontinued. But it speaks to the fact that we have so many more effective tools in our tool belt that we utilize for our patients. And while I don't consider myself a supplement hater or basher, I just want you to be aware of the difference between supplements and medications and how they are brought to market. And I want you to choose the treatment plan that is best and most effective for you. If you have any questions, please let me know below. I would love to either answer them directly or create a video for you and go into more depth. If you want to learn more about overall health and metabolic health and weight management, please subscribe. Please like this video, and I will talk to you next week. Take care.